You are here today because you're going to receive radioactive iodine treatment as an inpatient after your thyroidectomy. Radiation is a form of energy. Every day we are all exposed to radiation from natural sources known as background radiation. This can be anywhere from the environment we live in to the food we eat. We also use radiation in hospitals for imaging and for treating disease. Radioactive iodine treatment involves taking radiation in the form of a capsule. After swallowing, it is absorbed into the bloodstream and taken up to the thyroid. The radiation then works to kill any remaining thyroid cells that weren't removed by surgery. Any excess iodine that the thyroid doesn't use will leave the body as urine and sweat. Your doctor has considered the benefits of this treatment and makes sure they are safe and outweigh any risks. The treatment is painless, but will leave you radioactive for a period of time. To make sure that the radiation doesn't affect others, it takes place in a dedicated, single ensuite room in the hospital. This room has been fitted out with large windows and a range of facilities for you to use, including a fridge, TV, phone, and anything else you might need for the few days you stay here. Before your treatment, there are many steps you need to follow in preparation. You'll be asked to maintain a low iodine diet as specified by your doctor. This is to help prepare your thyroid to take up the radioactive iodine for your therapy. It's important that you avoid pregnancy or fathering a child for at least 6 months. The team will ask you about pregnancy and breastfeeding in order to make sure that you aren't before you go ahead with the treatment. You will go to the endocrinology department for a blood test and a thyrogen injection to help stimulate any thyroid cells to take up iodine. The following day, you will be given another thyrogen injection and brought to the nuclear medicine department to meet the physics team and discuss any precautions that need to be followed after your treatment, such as staying off work. Some patients will then be given a small amount of radiation in the form of a capsule. There will be no restrictions from this in terms of coming and going from the room. Next, you'll be brought to the Victor Singh ward where you'll be staying during your treatment. In the morning, if you have had an uptake capsule, you'll visit the nuclear medicine department for a measurement. After this, the team will meet you back in your room in the Victor Singh ward and you'll be given the treatment capsule. From this point on, your radiation protection restrictions are in place. You'll be asked to stay in your room during your treatment, but the doors are not locked. Before the treatment, you'll be asked to wear your old clothes. We suggest that you wear those clothes for the duration of your stay and leave them behind when you go home. For a few days, we restrict visitors and staff from coming into direct contact with you. Your meals will be brought to the room by catering staff and left for you to take into the room after they've gone. They will check on you each day, but won't come into the room unless you need assistance. In the afternoon, the medical physics team will come to your room and take a measurement. This will help tailor the radiation safety precautions for you after you've left the hospital. In the morning, this measurement will be repeated. The team will discuss when you can be discharged and any guidelines you must follow. Before you go, you will have a scan in the nuclear medicine department. Beforehand, you should shower and put on clean clothes. You'll receive a phone call telling you what time to come to the department for your scan. Keep your distance from others, especially children and anyone who could be pregnant. And if travelling in a car, sit in the back, opposite seat of the driver. At home, you should follow the guidelines listed here for the restriction period, plus an additional week for anyone who is pregnant or in direct contact with children. Please follow good hygiene practice, such as washing your hands after the toilet, flushing the toilet twice, and showering daily. Please don't share cutlery, plates, or towels. They are fine to be used by others once they have been washed. You should sleep in a separate bed. Please avoid any social events and reschedule any non-urgent medical, dental, or beauty appointments. It is very important that you avoid pregnancy or fathering a child for at least 6 months after your treatment. If you are traveling within 3 or 4 months of your treatment, you will be given a travel letter to take with you. In case of an emergency, or if you need any urgent medical care, you will be given a special card to present to the hospital you are attending.
And lastly, over the next 12 months there will be a blood test, followed by a series of checkups in our outpatients department. If you need any more information, you can contact the RPA or the Nuclear Medicine Department using the numbers below.